Good afternoon and good morning to some people and good evening to others. And welcome to our 12th in our Webinar Wednesday series. Actually, with this microphone in front of me, I feel like a combination of Walter Cronkite and Edward R. Murrow. We are dealing with the pandemic in Israel. What happened there? What went wrong? It was leading the world with numbers, and now it seems to be going the other direction. Shalom, bonjour, and hello to all of you who have registered from around the globe. To be exact, Israel, England, France, the United States, and of course, Canada. I would particularly like to say bienvenue and welcome to Marie-Hélène Bérard, President of Les Amies Françaises de l'Université de Ben-Gurion de Negev, the President of our Associates Office in France. J'aimerais aussi souhaiter la bienvenue à Madame Marie-Hélène Bérard, Présidente des Amis francophones de l'Université Ben-Gurion. We might also have some more of our colleagues from the associates offices around the globe. And many of you know that I am Mark Mendelson, the fiercely proud Chief Executive Officer of the Canadian Associates of Ben-Gurion University. And it is once again my pleasure and honor to be moderating today's program featuring two of Ben-Gurion's best. I'm thrilled to tell you that we have over 110 people signed up for the webinar, and we expect even more to watch us live streaming on Facebook. Our last webinar had more than 150 doing that on FB. My staff and I have to tell you, spend many hours discussing which experts and from which field to invite from Ben-Gurion University, because there is such a wide and deep choice. And I believe so far that we have chosen wisely, very wisely. Our webinars have resonated with our followers and friends. So on behalf of the lay leadership and staff of CABGU, Canadian Associates of Ben-Gurion University, I welcome you and thank you all for joining us. I must say that this is just another feather in our Canadian cap of successes, or our Canadian tick of successes during these difficult COVID times. As many of you know, only a month ago, we had almost 800 guests attend our national virtual event featuring actress and neuroscientist Mayim Bialik, President Danny Chaimovitz, and Senator Linda Frum from Toronto. We also just completed a Support Our Students emergency aid campaign and successfully raised over 1.3 million Canadian dollars, reaching our goal of $1 million US. We promised and we delivered. As I said earlier, I am definitely a very proud CEO. And for those of you who know me better, you know that we are approaching the winter months because, as you can see, I am now wearing my tie and my little handkerchief in my breast pocket of my jacket. Our format today will be quite similar to our past webinars for those of you who have attended any of them. I will introduce both Professors Nadav Davidovich and Danny Filk, who have both become very sought-after commentators in Israel on the pandemic. And this will be the third time that we are featuring Nadav, who also spoke at a Hebrew-only webinar that was sponsored by Ben-Gurion in BGU in Vancouver. Both will speak for about 15 minutes or so, and will be followed by the Q&A, which will be run by my colleague and Executive Director of Montreal and Ottawa, Simon Ben-Simon. I will give each of them a 2-minute warning when they have 2 minutes left in their presentation. Zach Ostrov, our Executive Director of Winnipeg, will once again resume his duties as Chief Resident Techie of our team. Whoever has comments or questions, you will see the icon at the bottom of your screen, which you will just have to click on to submit your question. Remember, the topic today is the pandemic in Israel. What has happened? What went wrong? And I have to tell you, my wife and I subscribe to Israeli TV, and we watch the news every night, and what is going on there is quite exciting and very perhaps indicative of the personality of Israel. 3 people and 23 different opinions of how what we should do and how we should create protocol. Before I make the official introductions, I was just thinking of the CVs and professional lives of our 2 esteemed speakers and how they really epitomize the uniqueness of the academic staff at Ben-Gurion and the approach to various subject matters. Where in North America would we find so many MDs who are also professors of political science, business management, etc., like at BGU? I have many friends in the medical field in Canada, and they some of them are researchers, but none of them teach, are professors of political science, political thought, et cetera, et cetera. Anyhow, those are just the musings of this CEO. I suppose that's my few minutes of. Now, to introduce our guests, I will introduce them both, and then Nadav will have the screen first, followed by Danny. Nadav was born in Haifa and graduated from medical school at Tel Aviv University, which we will not hold against him. He served as a physician in the IDF and left with the rank of lieutenant colonel, having one rank higher than me, who's a major. After years as a battalion and brigade physician, as well as the head of the epidemiology department of the IDF. He completed his master's in public health from BGU and his PhD from Tel Aviv in 2004, and 2005. Today, he is a full professor of health sciences management in the Faculty of Health Sciences at BGU, as well as teaching at the Guilford Glaser Faculty of Business and Management. He established Israel's newest and largest and most important school of public health at Ben-Gurion University 4 years ago. He is the author of more than 120 highly regarded papers and book chapters. Danny Filk was born in Buenos Aires in 1959, and although he is only 10 years younger than me, he looks about 30 years younger than me, I have to say. Either I look old or he looks young. He made Aliyah in 1984, actually 10 years after I made Aliyah, after completing medical school cum laude. He started his medical career at Barzilai Hospital in Ashkelon and went on to become the medical director of numerous Kupot Cholim, or HMO clinics, as we would know them in North America. Danny completed his PhD at Tel Aviv University, another guy who went to the wrong school, on the neoliberalism of healthcare in Israel. While working as a physician, Danny became a lecturer in BGU's Department of Politics and Government. He is currently a full professor at BGU and is head of the Center for Health, Humanism, and Society. Another outstanding representative of the brilliant diversity and backgrounds of BGU professors and researchers. Nadav, the audience and computer screen is all yours, and then it will be yours, Danny.
Thank you so much, Mark. It's a great pleasure to be again with the Canadian Friends of BGU. Also, it's a great pleasure to be together this evening with Danny, who is a very close friend, and actually I'm going to present the public health point of view and Danny more the political, but maybe just to start, I want to question this kind of a so-called dichotomy that I'm sure that Danny will agree with me on many different levels, because of course we know that our health is determined by many different social, economic, environmental determinants of health, and in the last 2 decades, more and more we are aware that politics is also one of the determinants of health. And maybe an interesting discussion is to understand, the differences between, sometimes they call it, politics with a capital letter or small, different kind of politics. And of course, I would say that medicine and public health in general is one of the social sciences. And those of you who are, interested in social medicine and social epidemiology, we know that how much politics and especially in relationship to power relation is important. So there is always this discussion, what is the actual, is there really a tension between a public health perspective, sometimes represented by lockdowns, and the economic perspective that might be represented by reopening? And I think this is a false dichotomy. Just to remind you, we started all around the world, including in Israel, with getting cases, at least in Israel, coming from other countries. this was the first stage of containment. And interestingly, those first cases were mainly those who are part of, let's say, globalization, people that are coming from other countries. And it was quite clear that very soon the situation changed dramatically. And although there is this cliche that, diseases know no borders and they don't differentiate between rich and poor, but of course, this is very, very simplistic, because we knew that when we are going to have wide community transmission, and the whole idea at the beginning was to delay it as far as possible, but we knew that finally this is going to happen, because we have a disease that it's widely transmitted. There are lots of asymptomatic cases that are also transmitting. This is now clear. We had lots of disputes about it at the beginning, and especially from people that had no clue about epidemiological investigations, especially physicists. I still remember Professor Eli Waxman. Those of you who are following, he was a chief advisor, that he was saying there are no asymptomatic cases, and he developed a whole theory that was very disconnected from reality. So then it was clear that when this is going to turn into wide community transmission, that of course the question of socioeconomic status, the question of the relationship between poverty and illness is going to be very important. And indeed, now that when we are doing an analysis of all the cases, and especially severe cases, we definitely see that many cases, and especially deaths and severity, are of course related to the question of poverty, socioeconomic status. And this is true for many different reasons. It is true because of the density of living, but also after being infected, the question of access to healthcare, and also chronic conditions and other risk factors, of course, are not distributed all the same throughout all different parts of society. So when we had what is called the first wave, and I'm one of those who are criticizing this idea, because I think we still actually in the first wave, we had the first lockdown. It's like having a blanket on a fire. When you took up the blanket, it's rising up again. You might say that the first lockdown or the first period was perceived as successful, but and here I think also Danny will agree, I think this was a very problematic analysis, because we had all the opportunity to be successful, because Israel is preparing for pandemics already for about 2 decades. I've been involved also when I was in the military, in the Ministry of Health. And also Israel is a kind of a relative kind of an island, that it was quite easy to take the decisions to block the borders. But it was quite clear that answering the crisis cannot be just by counting numbers of people that are infected, number of deaths, but it must be something that is much broader and integrated. And here, and I'm sure that Danny will speak about it, all the economic preparedness and the way of dealing with unemployment, etc., during the first wave, when still trust in both the government and even more so in the different experts was very high. I think we wasted lots of time, and doing the first lockdown probably took down the numbers, but we failed to continue and prepare for a much more comprehensive approach. And I'm talking here about all different determinants of health. I'm talking about preparing schools, what we're facing now, and I'll return to it. We are talking about unemployment, how to deal with different businesses, how to deal with nutrition, and especially how to prepare the healthcare system. Now, we know that in every country, actually the pandemic was entering, and it was based on existing structures. And in Israel, like in many other places, but now I'm talking about Israel, unfortunately, we're talking about more than 2 decades of underinvestment in the public healthcare system in all of its parts. Many times we're looking about hospitals, but it's also about community healthcare and also about the public health services. When I'm talking about public health services, I'm talking both about the workforce, public health physician, nurses, health promoters, and I'm talking also about the infrastructure of doing the contact tracing and epidemiological investigations. So we exit from the first lockdown, and another problem was that it was presented as a great success, and Benjamin Netanyahu was saying, okay, almost like let's go and party, forget about Corona. And this was totally against the expert opinion. The expert opinion was that we need to be very, very gradual, waiting 2 weeks after every step, and very quickly during May, when we exit from the first lockdown, almost everything was disintegrated. And I think this is very great from many points of view, but even from a moral point of view, because the public sacrificed so much, and we actually lost a control very quickly. And here gradually we learn more and more about the corona and the pandemic. I'm talking both from the clinical point of view, also from the epidemiological point of view. But we saw that there was a very, very centralized position. Danny will speak more about the political context. We need to remember that we were after 3 elections, all the discussion about a united government, etc. But we also lost time in terms of preparing the different systems. Things were very centralized, and I'm talking both about the testing system, about the decision making, not giving enough power for the health district, because in epidemiology, in public health, you want to act in a differentiated manner when you can. And here, during, I think it was June, Professor Ronnie Gamzu entered into the scene. And I know that many times, people are looking on Professor Gamzu and I'm on his advisory committee in a very simplistic way, when things are presented to the government and, all the tension between the ultra-Orthodox community and the question of the high holidays. But actually what Professor Gamzo did, I think was really important on many different levels. One, he said from the beginning that having a lockdown will be a failure. And actually the second lockdown, from my perspective, was a failure. He was speaking about a differentiated approach, and we were planning for several weeks what we call the traffic light system. And then it took about 2 months to approve it, when it became already obsolete and not relevant. And also many times it was not really understood, because the traffic light system was not just about stigmatizing a certain area, just the opposite. It was about giving more tools, more resources for municipalities, having an integrated approach. That's the other aspect that I think that Professor Gamzu brought with him. So not just the Ministry of Health, but Health in All Policies working together with the Ministry of Welfare, working with the Ministry of Education, creating a much better system of contact tracing that now it's being operating. And today, yesterday, we were shown all the different indicators, and I'm talking about a huge difference than the first wave. In parentheses, I would say that it's very sad that all these resources are being brought now, when for more than a decade we are asking why the public health services, all the infrastructure, the computing system, the indicators could be developed before, and every time we need the military to save us. That's another interesting question that is broader than the question of COVID-19. So Professor Gamzo brought with him a more integrated approach, and also brought in the sick funds, the Kupot Cholim, that became much more dominant. All the testing system was improved, and now we have the capacity of doing about 70,000 tests per day, and Israel became a country with a very high number of tests. And then again, both the mistake of going out too quickly from the first lockdown, and also not building the capacity also outside the Ministry of Health, for example, in the Ministry of Education, not decentralizing in terms of the municipalities, gave, and unfortunately also the problems
Nadav, shtei dakot, 2 minutes, Nadav.
Okay. Also the problem of not preparing enough for the economic system. This created, and all the way that it was dealt in the political arena, in the parliament, and by the government, created a huge mistrust, especially by different groups of society that were actually kind of excluded in the decision-making process, both the ultra-Orthodox community and the Arab community. By the way, the Arab community is very interesting. Part of the response, I don't have the time now, maybe in the Q&A, on many different, for many different reasons, I think there is a very interesting success among the Arab community. Many of them are also involved in the healthcare system, but there are still lots of problems, and also the civil society was very involved. So just to conclude, I think that getting into a lockdown finally is a failure. Sometimes you don't have any choice. You need to harden your system. I think that it could be done in a much more productive and efficient way, giving people the option to do physical activity. All the limit of 1 kilometer, I think it was a bad idea. And now we understand that you can do also activities, you know, outside. Finally, also the Ministry of Education conducted it. So what we do now is to continue and do a much more integrated approach, take into consideration also the political context as something that is very important, not just as a barrier, and giving much more power to the, of course, with the resources to the local communities. We are now entering into the winter. All the sick funds prepared lots of interesting, important programs, moving to the community, strengthening the community healthcare, and we need to understand that we still need to learn how to live with COVID-19, because it will take a lot of time until we're going to have a vaccine. And even if we have a vaccine, this is not going to be a panacea. There'll be a question of priorities and access. We are going to have now Professor Nachman Ash replacing Professor Gamzo. I think it's a good choice, but it's also very sad that many times we are calling former surgeon generals to enter into the system, although he's working already 10 years in the community healthcare. And that's another thing to question or to think about, what is really the role of the military and the militarization of all the, even the terms and discussion, talking about ticking bombs, people as ticking bombs. I think it's a very problematic aspect. On the other hand, I truly think that with civilians and the Minister of Health leading and the help of the Home Front Command, if it's done in a balanced way, that's something that might also be a good way of moving forward. Thank you.
Nadav, toda rabba. And now, Danny, please. Computer is all yours. Nadav, I love the picture of your family.
Thank you.
Okay, thank you very much. I really appreciate the opportunity to talk with you. Just a minute. I want to share my screen, but for some reason here. Okay, so once again, thank you, Mark, and thank you all for giving me the opportunity to talk with you. I will try to present some points about a political overview about what went wrong, but I want to begin by talking a little bit how Israel arrived to the pandemic. Israel arrived to the pandemic with a GDP per capita which was growing steadily for the last 10 years. It entered the pandemic with a debt to GDP ratio which was going down steadily during the last 10 years. It entered the pandemic with a private per capita, a growth in the private per capita consumption that was greater than the OECD average. So really, and with a very low rate of unemployment. So from the point of view of the indicators of the economy and also of the economic development of society, the indicators were very good. But there was a shadow within this bright picture, and the shadow was Israeli primary civilian expenditure. As you can see, by 2016, Israel's civilian expenditure was among the lowest within the OECD, among OECD countries. Why this is important? Because one of the things that went wrong in the pandemic was the lack of preparedness of not only the healthcare system, but also the education system, and in generally of the public system. And this is due to a prolonged lack of a public investment in infrastructure, in professional workers. It is very clear Israel has one of the lowest ratios of nurses per population among the developed countries. It has already a problem of physicians. It will face an even worse problem of physicians because half of Israeli physicians are 50 years or older, and the rate of new physicians entering the system is very slow. So those are why I am telling you all this, because this reflects in the ways in which Israel could have faced the first, or Nadav rightly says that we shouldn't speak about waves because it's the same wave, but the first peak of the epidemic. And as you probably know, and Nadav referred to, on March and April, the health results were very, very good. Mark also commented on this, but already the socioeconomic policies were very problematic. Instead of adopting the model of Germany or Norway or the UK, that in which the government contributed to maintain workers in their employment, Israel went for a model in which people were fired or they were on an unpaid leave, and the Social Security paid them for during that time. But this policy is very problematic in two senses. One is that it creates a lot of uncertainty for people because they don't know what will happen next, and that has health consequences. And the second point is that if people, the uncertainty deepens the recession, because people who are not sure whether they will be working once again in a couple of months or not, they tend not to spend. So the recession due to the quarantine was worsened by people refraining from spending. The combination of those two points contributed to what Nadav depicted before, a very, very quick exiting from the quarantine without a real plan, without preparing society, and it also very much undermined confidence. And then, so that was the reason that in August and mainly September, Israel figures were among the worst comparing with other developed countries. But we also had, we had in fact both very bad figures in terms of health and very bad figures in terms of the economy. As you can see, by the end of September, the number of unemployed has reached almost 1 million. What this is more or less 25% of the Israeli working force. Almost 70% of them were in unpaid leave. The services and sales sector was the worst situation. Female unemployment was higher than male unemployment, and most of the half of the unemployed are young people up to 34 years old. The COVID impacted very bad on the self-employed, much more than among the salaried, and the economic impact of the epidemic and of the policies adopted by the government hit more low-income households and those workers with low levels of education. As you can see, 45% among lower levels of education reported income loss, 41% among those with technological education, and only 26% among respondents with an academic education with a college degree. So there was an interaction between inequality and the crisis, and also there is and Nadav referred to that, there is a relationship between not only in Israel for sure, between social inequality and vulnerability vis-a-vis the virus. Now, that is the context in which we are now. That is the context of what went wrong. But apart from the economic policies and the socioeconomic problems, Israel arrived to the crisis with a severe lack of public trust in the state institutions. The center and the left didn't trust because what they saw as the corruption of a prime minister who decided not to resign, though he was indicted. For the supporters of the right, lack of trust was represented by the fact that what they saw as an organized plan by sectors within the state institution, mainly within the juridical institution and the police, to bring a democratically elected prime minister to resign. So whether you were from the left or you were from the right, there was a feeling that institutions are not only are not working as they do, there was a deep lack of trust in institutions. As Nadav said, trust is fundamental for public health, especially in times of pandemic. So what happens now? What is the political situation now? We have, in fact, three main groups of people protesting. One group, which is the less identified politically, are the self-employed. This is a picture of one of the demonstrations of the self-employed. The self-employed, as I've said before, have been really badly hit by the crisis, and they are the ones who have less responses from the government, because they usually don't receive unemployment payments. So they were completely dependent on punctual transfers of money that the government did. Some were from May up to July, and living on increasing their personal debt or living on previous savings. So much so that a couple of days before, the Minister of Finance said that the self-employed should use their pension funds, the money of their pension funds, in order to overcome this crisis. But then you can ask yourself, okay, but if you're a self-employed around my age, 60 years old, and you know that you have maybe another 10 years that you can work, and you are using now your pension funds, then what will happen at old age? So it's clearly not a solution. Now, interestingly, this is a group that mostly identifies itself as right-wing. Many of them are traditional supporters of Likud, and this explains also the fall of the Likud and Netanyahu in the polls. The second group is what you could call the Balfour group. Balfour is the place in which the prime minister residence is, and this is a picture of one of the demonstrations in Jerusalem, in the surroundings of the prime minister residence, and those are mostly, you could say, liberal Israelis that the main reason for the protest.
Danny,
Yes.
Dos minutos.
Yes, thank you. The main reason for their protest is their opposition, the corruption issue. The third group are the youngsters. Those are called the Pink Front, and the Pink Front are young people who feel that they don't have a future, and here the 50% unemployment rate among youngsters under 34 years old is one of the reasons bringing people to the street. Now, are those, will this protest influence the political scene? It is hard to say. It is hard to say also how crises are translated into the political scene. We can see, as I said before, that Likud is falling in the polls, but most of Likud votes are going to the right-wing party Yemina, headed by Naftali Bennett. So in terms of the balance of forces between the center left and the right, there are no real, maybe even a strengthening of the right. Does that, and what is clear is that the crisis is also the crisis of the political sphere, of political institutions. The Knesset is almost completely paralyzed, and what is worse, the government is almost paralyzed. Using a medical metaphor, you could say that in a way the government now, and for sure that contributes to the to what went wrong, the government could be compared to a heart undergoing what is called ventricular fibrillation. In ventricular fibrillation, which is one of the causes for sudden death, what happens in ventricular fibrillation is that every cell, muscle cell in the heart contracts independently. So the heart isn't not able to push blood to the body. The result is, as I said, sudden death. This is what we feel sometimes with the government, that each ministry, each member of government is working by himself, trying to explain why the areas under his or her responsibility should be exempted of limitations. And what we have lost, what the government, the feeling among the public is that the government lost any commitment to a common idea of the common good. And this is expressed in the polls, where almost 75% of the population feels that the government has failed in coping with the pandemic, both at the economic level and at the health level. And this very high percentage of people thinking the same is very unusual in a very polarized society as the Israeli one. In fact, I think that since the social protest in 2011, we didn't have so many people thinking the same about the political situation. And do we have signs of hope? I think that the signs of hope are mainly two. One are the very high number of expressions of social solidarity that we saw both since March until now. So a bottom-up solidarity. And the second reason for hope is the very active citizenship we have. I think that protests, on one side, represent people feel that things are going wrong, but protests, and there are also protests, there are also demonstrations in support of government. That means that we have an active citizenship, and I think an active citizenship is a very good antidote to the problems of the political communities.
Danny, Simon, are you coming on? Simo?
Yes, I am on.
Okay. Very fascinating, as I knew it would be. And now Simon will take over with the Q&A. And I know that we have some very interesting ones, not only about Israel, but also about North America. Simo, c'est pour vous.
Okay, thank you very much. Welcome everyone. You both mentioned the concept of trust, and Danny, you finished on an optimistic note. which is always a good thing. But how can a government or a public health administration manage a crisis when there is such a lack of trust in the government? Nadav, you want to go first?
I'm actually leading now for the Israeli Institute for Health Policy Research a working group on the question of trust. First of all, we need to remember that there are many stakeholders here involved. So the question, about trust is more complicated. On the previous work we did about before COVID, we spoke about circular trust, what happened when the public is not trusting the government, but also the government or the experts sometimes are not trusting the public. And of course, this is not just going to happen. I don't think that just presenting data, for example, there is, I think, an illusion that if you're going to present the data and you'll be transparent, so suddenly everybody will trust you. I don't think that this is the case. I truly think that right now, in a really fragmented situation with the government, there is a lot of things that are going very well with the local authorities that we are working with them. In the Negev, we have a coalition of civic society organization, including Physicians for Human Rights, AJIC, the Association of Arab Bedouin Physicians in the Negev. And what we are doing, and it's related to a question that Shira Freeman, hi Shira, because we know each other, is asking here, that many times you can work on the mid-level. We develop also this concept of a middle out. Okay, sometimes we're talking about top down and bottom up. The middle is also very important. And working with mayors and civil society, I think that's something that is very important. We know, for example, that people trust more, again, it's before COVID, people are trusting more the family physician than, a message from the government about are you going to be vaccinated? So there is no simple answer. I don't think that the trust now will be related so much to the government. I think the mid-level and the civic society now is very important, and there are lots of initiatives, but we need to be very careful not to create more disparities, because, for example, decentralizing in a way that only the strongest municipalities will give, more manpower for the education system, etc. So we need to be very careful also about that, how doing it.
Danny?
Well, not surprisingly, Nadav and me agree. You said that I finished with an optimistic note. I want to say that I'm usually an optimistic, but being optimist, I think, is not being sure that things will go well, but believing that things are not mandatory going wrong. So that it's not mandatory that things will go wrong. That politics and societies are open to change, so we do have a severe problem. And for sure, it would be much better if the Israeli society arrived to the pandemic with a higher degree of trust in state institutions. But on the other side, I think that the epidemic very much strengthened the confidence in the local, at the municipality level. People very much trust their family doctors. People trust the HMOs, the Kupot Cholim, which function really astonishingly well during the crisis. And in many ways, people trust each other. So I think that what we need is to rebuild trust bottom up, and not to believe that it will be a kind of top-down way of reinstating trust.
Thank you. So do you think this will engage in other systemic changes in the political system in Israel? You know, we're coming from a decentralized federal system where Canada, the crisis has been managed by each province with some guidance from the federal government, but the federal government has mostly intervened economically in providing subsidies for businesses and for individuals. Do you think that that could lead to, in Israel, to a more decentralized setting?
Well, Israel is a very, very, very centralized country. It's also very small, which, you know, there is a relationship between geography and centralization. You can't be too centralistic in a country with the dimensions of Canada, and you can't be too decentralized in a country with the dimensions of Israel. But I think that there could be a change. Once again, we have to take into account that crises do not translate very quickly into changes. If we think, for example, about the Yom Kippur War, between the change in government and the Yom Kippur War, there was 4 years in the middle. So it takes time for societies to internalize the significance of a crisis and translate that internalization into changes. So don't hope that next month we will have a completely decentralized Israel. But I think there will be changes in that direction, among other changes.
Thank you. Nadav, you mentioned the role of the military. There's a question about, could have the military played a larger role in managing the crisis? And I know, we know that there's always this balance in Israel between the role of the military and the role of the political, and how much space to give the military in civil society. Can you elaborate on that? And I'm sure Danny, from the political perspective as well.
So it's a very interesting question. I can say that Danny and I are now exactly working on this question together for hopefully publication. We actually discussing this question, I think, Danny, right, more than a decade, I guess. On the personal level, I myself served as, Danny also served as a military physician. It's very complicated because there are different levels here. There are the question of, the medical corps feeding the system, and that's something that is going on from the beginning of Israel. If you think about people like Chaim Shiba, and he was the Surgeon General, etc. I cannot think about the public health system in Israel without many key figures, including myself, I'm not a key figure, sorry, but many people from the public health system, and there are maybe 120 public health physicians in Israel. Many of them were trained in the military. So this is one aspect, but of course, it can be very different. I was volunteering with Physicians for Human Rights already when I was in the military. These are things, for example, you won't find probably in the US. I don't know about Canada. We have this multiple personality disorder many times in Israel. The other aspect is the aspect of how you are framing the problem. And, you can frame public health in different ways. And one of what we think it's maybe very problematic is to frame the question of COVID-19 or other public health issues as mainly as a kind of security problem, us against them, thinking about the police and the military as your first allies. And this, of course, is very problematic. I do think that we need to strengthen the civilian sector. Unfortunately, the Reshut חירום Leumit, the emergency agency, I don't know exactly the English term, that was formed after the Second Lebanon War, when the Home Front Command failed in many different ways, was actually totally kind of degenerated, especially during Netanyahu regime, and didn't operate really. And so I think that the Minister of Health, of course, alone cannot deal with such a crisis, because when you're talking about pandemic any pandemic, it's not about the just epidemiological and clinical aspect and medical aspects. It's also about the economy, about education, etc. So you need to have something that is very essential. This was, I think, very problematic all the way. On the medical level, I think that what is happening right now, it's a good compromise when you have the Home Front Command and the Minister of Health working together. But it's very sad because if there were the right investment in the system, we could have the contact tracing and all of that already being built by. So there are many different aspects, and it's a very interesting question. I prefer that it will be led by civilian sector, and the military, of course, can help. The other issue is how we are framing it, and in Israel, most of the time we're framing things in a very narrow kind of security option, and this can be very, very problematic. To call people picking bombs, okay, or to use even the language of the occupation, you know, like a seger, a siege. I think there is something very deep going on that we need to think about.
I would only want to add one thing is that I show you the low levels of civilian investment in Israel. The military is the only state institution that didn't suffer from lack of funding. So in a way, it's not surprising that it's the only institution with the capacity to cope with some of the needs. If we had, as a country, if we had invested in the health infrastructure as we invested in the military infrastructure, probably the Ministry of Health wouldn't have the need to call the military, because we would have the civilian capacities to cope.
Well, thank you very much. It's 12:59 Eastern, and we usually promise people that we close up within the hour, so I will turn it over to Mark Mendelson to close this session.
Okay. You know, I have to say, when I see you guys on TV in Israel, and I see you can tell by the expressions on your face the tensions and the differences of opinion. It's very nice to hear such an honest and insightful analysis of what's going on. Guys, you were terrific. Thanks for taking time out of your obviously busy schedules. You're on your way to meetings with this government agency, with that military agency. You're putting in a lot of kilometrage, as we say in Israel. Huge thanks to all of our listening audience for supporting us and the outstanding Ben-Gurion University. If you would like to find out more about BGU and the research being conducted there, please check us out at www.bengurion.ca, which is our website, or else the university's website itself. I would really like to thank my staff team across Canada, Simon Ben-Simon, who once again handled the Q&A period so well, although he did have, I know, a couple of questions pertaining to your thoughts about how COVID is being tackled in the United States and Canada. Maybe that would have been a little too political. Michelle Richmond, my executive assistant, Shimi Wenner, executive director of Toronto, Sam Cordes, COO, Paulina Pshenishny, our executive assistant in Toronto, Zach Ostrov, our techie and executive director of Winnipeg, and David Burson, executive director of Vancouver. Thank you, National President Mitchell Olbaum, a great mentor, advisor, and friend, and his leadership team. Thanks as well to my excellent colleagues in Israel, President Danny Chaimovitz, who himself is now recovering from COVID, and he's recovering very nicely, back in the saddle, as we say. His Vice President, Jeff Kay, and his team, and Doug Sesserman, my CEO colleague of the American Associates. People, stay tuned for our next webinar on November 18th, featuring BGU's very own Professor Yuval Elovitch, who probably has more secrets about what's going on in the cyber world than almost anyone in Israel, but he won't tell you any of them. However, he's fascinating, and he is going to be featured in our webinar on November the 18th. And of course, Ben-Gurion, like all world-class universities, relies on its supporters to be able to continue its innovating and out-of-the-box research, some of which you were exposed to today by two of our outstanding researchers. Please call one of our offices if you too would like to help us. And until November, I wish you a COVID-safe 3 weeks. Wear masks and don't forget to social distance. Toda rabah, friends, chevre. Thank you very much, everyone.
Thank you so
Thank
much,
you. Thank you so much, Mark.
Mark,
Bye,
and all of
everybody.
you.